Hello, my name is Tristan Hutchinson, and this is the inserting and discontinuing IV skills video. I want to make sure I have all the items needed. I have my gloves, my needle receptacle, which is a cup, my hand sanitizer, my 12-inch IV extension tubing, my NS, my IV catheter. It was supposed to be 18-inch, but I've used all of them. So it'd be an 18-inch gauge IV catheter, IV starter kit, as well as gauze, pen, tape, and I already have a couple pieces already cut off there, as well as a trash receptacle. Next thing I would do is check my healthcare provider orders before I enter the patient's room to make sure I have everything needed. Next thing I would do is I make sure I knock on the door, use proper hand hygiene, make sure I put my gloves on, introduce myself to the patient. Hello, my name is Tristan. I'm going to be your student nurse today. Can you please tell me your first and last name and date of birth? Great, thank you. He told me his name is Dustin Ramirez. I got his date of birth, and I double checked that to the bracelet that he's wearing. So I got my 2 patient identifiers. Next thing I would do, I make sure the patient have privacy, make sure I close the curtain. And I would, next thing I would do is explain to the patient, okay, your healthcare provider ordered an IV because it looks like you're going to have a blood transfusion today. Hence why I said 18 gauge catheter. The next thing I would let them know is going to take about 10 minutes or so. Also, I would say if there's any pain or anything that you're experiencing during this time, please let me know so we can go stop the process. Also, do you have any allergies? No? Great, thank you. Do you have any questions before we start? No? Great, thank you. Okay, so the next thing I'm gonna do is I'm gonna go ahead and prime my tubing. I'm gonna get that ready. I'm gonna go ahead and get my tubing ready. I'm gonna get my NS solution here. Now we go ahead and take off the top. I wanna make sure I'm not touching anything else so I don't break sterility. Okay. Go ahead and connect that. So what I want to do is make sure I'm priming my tubing to make sure that there's no air in it. Okay, so there's no air. I'm going to go ahead and set this to the side. Next thing I'm going to do is I'm going to go ahead and get my tourniquet. I would have already found my set. This was in real life. I mean I would already have the IV. Found my palpate for vein. Okay, so let's put my IV on. My tourniquet on. It's going to go about 4 to 6 inches above the insertion site. Okay, make sure I have a little bit of left over so I can go ahead for a quick relief. Then I'm going to go down. I'm going to palpate for a pulse. We got the pulse. Okay, and next thing I'm going to do is go ahead and take my alcohol. I don't have any more alcohol, so this is going to be my pretend alcohol to gauze. If I had CHG, basically I would go in a back and forth motion using a friction for 30 seconds, but I'm using alcohol that is pretend alcohol. And I'm going to start in the center of the insertion site. I'm going to go in a circular motion for about 30 seconds, working my way out. Okay, I'm going to go ahead and throw that away. Then next thing I'm going to do is prepare my needle. Get my catheter here. Okay, I'm going to make sure that when I pull the top off, I'm going to make sure that the bevel is up. The bevel is up. I'm going to make sure that the white cap is up as well. Then I'm going to go 1 to 2 inches below the insertion site, and I want to make sure I want to pull the skin down. Go ahead and taut. And then next thing I'm going to do is I'm going to go at a 30 to 45 degree angle. I'm going to go ahead and push in to the insertion site. Once I see that flash of blood, I'm going to go ahead and go in about 1/4 of an inch more, not more than that. Then I want to make sure I go ahead and I push the cap onto, going to make sure I push the white cap. I want to make sure my that is going the catheter is going to reach the insertion site. And so once I do that, then I'm going to go ahead and push the cap on the top here, releasing my catheter, and then I want to make sure my VAD is stable. Okay, and once my VAD is stable, I'm going to go ahead and take my non-dominant hand, and I'm going to go ahead and get my solution and connect my tubing. Make sure I'm not breaking that sterility as well. Okay, make sure my VAD is still secure. Okay, and then I'm going to go ahead and pull back on the solution on my tubing to make sure that, to see if there's a little bit of blood, and there's blood. So the next thing I'm gonna do is I'm gonna go ahead and infuse the solution in, making sure that there's no pain or anything that the patient experiencing. You have any pain, sir? No. Great, thank you. I'm gonna go ahead and finish that there. The next thing I want to do is, before I would have started that, I would have made sure I've taken off I would have released my tourniquet before, after I would have released my catheter. Okay, so next I want to make sure I take my tubing. This would be how I have that secure. My tubing is in. My tubing is locked. The lower lock is locked on my tubing. Okay, so I'm going to go ahead and now I'm going to release my solution. Okay, like this. I'm going to go ahead and get rid of that inside of the needle receptacle. This would have been inside the needle receptacle as well. And then I want to make sure that I get my Taggart. I have my Taggart. I apply my Taggart. It wouldn't cover my my complete IV, but I make sure it's covered just enough to keep the my hub in place. The next, I want to take this off here. Okay. Then I want to get my loop. Put my loop. Get that here. Get a piece of tape. Make sure I put that on there to the side as well. Then next thing I'm going to do is I'm going to get my paper here, and I'm going to put the time, the date. I'm going to initial it. I'm going to put the gauge of the catheter, as well as the length of the catheter. Okay? And then once I do that, I'm going to go ahead and put that on top. Okay, just like this. I make sure I get everything cleaned up, and I will let the patient know everything went great. Ask them if they need anything, they had any questions. No, great, thank you. I make sure that they have a call light, and then I would tell them I'd be back in later to check them if there's anything else that's needed. Okay, great, thank you. And then I would go ahead and I go out and I would document everything that just transpired in the room. Okay, now it's been a few minutes later, or it's been a little while later. The next thing is to go ahead and to discontinue the IV. So what I would do is I'd make sure I'd have my gauze, I'd have my gloves, and my tape. Okay, so what I'm gonna do is read the healthcare provider orders. Okay, it says I can go ahead and disconnect the IV. I knock on the door, do proper hand hygiene, get my gloves, and say, hello, it's me again, Tristan, your student nurse. Can you please tell me your first and last name and your date of birth? Great. Dr. Ramirez, that's your date of birth. And looked at the race ID, so I got my two patient ID identifiers. The next thing I do is I'll explain exactly what's going on. We'll have, okay, Mr. Ramirez, so your doctor said you no longer need the IV. Everything went great. So this is going to take about 10 minutes or so, or about 5 to 10 minutes. Do you have any questions for me? No? Great, thank you. So the next thing I'm going to do is first I'm going to go ahead and I'm going to take off my label here, and then I'm going to take off the tape that had the loop on. Just do it gently. Okay. Then the next thing I'm going to take off is the Taggart tape. I'm going to make sure I do it real slow, so I'm not injuring the patient or pulling out anything or causing any type of pain. Okay, perfect. You throw them in the trash. The next thing I'm gonna do is I'm gonna go ahead and I'm gonna get my first gauze, and I'm gonna put just a little bit of pressure on top there. Now I wanna make sure I disconnect the tubing. Okay, right there. And then once I do that, I'm gonna go ahead and I'm going to disconnect the IV, pull it out, and go ahead and put that inside of the receptacle, and then check to see if there's any bleeding. There's some. Looks like he's about clotted up, because I would hold on there for about 30 seconds, applying just gentle pressure, and then go ahead and put a new gauze on, get the tape, put that on top, and then I say, okay, sir, that's about it. We got it. Your IV is removed. If there's anything else that you need, any kind of questions, no, great, thank you. I'm gonna go ahead and give you your call light. And if there's anything else that you need, go ahead and hit the call light, and then we'll be back in there. And then I would go and leave the room, take off the gloves, use proper hand hygiene, go out and then document everything that transpired. That's it. Thank you.